Hi, we're sisters Elaine and Brenda.
Welcome to the Body Wealth Podcast, a space for conversation about the wealth that really matters.
Your best health. Hi, Paige. Thank you for joining us today. How are you doing?
Hi, I'm great. How are y'all?
We're good.
Very
Thank you.
well. Let's see, before we get started on our topic today, could you tell our listeners a little bit about yourself?
Yes, of course. So my name is Paige Hardy. I am from Durham, North Carolina. And if you're from Durham, you know we call it Bull City.
That's
So, I
right.
got to throw that out there. I actually currently live in Atlanta, Georgia. So I am a realtor who's duly licensed in North Carolina and Georgia. I absolutely love what I do. I'm a people person. So that's like my favorite thing is engaging with people. Outside of being a realtor, I am really passionate about my disease, which is sickle cell. So I serve on the North Carolina Sickle Cell Board that the governor appointed me to. So that is absolutely amazing. And then I just love spending time with family and friends and living life to the fullest. So that's how I would describe myself.
Wonderful.
Great. Well, thank you for being a sickle cell warrior. That's so important. And we want to hear about your journey with sickle cell. And let's just start with, we know people are born with this disease, but as a child, when was the first time you were aware that you had sickle cell?
So I really identified that I have sickle cell, I would say, when I was in second grade. I really didn't have any symptoms that I remember prior to that. I just remember like being in second grade, I had a really bad crisis and ended up in the hospital because of what you call acute chest syndrome, which is really common with adolescent sickle cell warriors. And so for me, I always equate it to like a toothache. So the way that your tooth is throbbing, because a lot of people have experienced that before, that like consistent pulsing, you can have that all throughout your body wherever blood flows. So as you can imagine, it is very painful. And so at the time it was in my chest. And so it was making me have issues breathing and like just that throbbing pain over and over and over again. And so I remember that because I was like, oh my gosh, I'm in the hospital. I'm in here for days. Like I can't be with my friends. And it was just like an experience for me really understanding like, okay, I have a disability and my life may look different, moving forward.
So you recognized at that time that this was going to be a lifelong journey.
Yeah, I feel like having sickle cell matured me really quickly. Like I picked up on things like, of course, my mom, dad, they've always been there, but I really wanted to understand my disability. So I just identified like, okay, I don't think this is everybody's typical experience in second grade. So I'm like, I think this is going to be a different challenge for me. And then that's when I understood from the doctors that this was something that I was born with and that I would have it the rest of my life because at the time there wasn't a cure to sickle cell.
So I know we've all heard of sickle cell, but can you just briefly explain what the disease actually is?
Yeah, absolutely. So sickle cell disease is a genetic disease. And what happens is you're not getting enough like blood flow and oxygen. And so because you're having lack of oxygen, it causes you to be in extreme pain or blood cells sickle. And so instead of them being like a circle that you want them to be, it's like a crescent. So you have a blockage going throughout your body and it could be pain wherever your blood is flowing on a consistent basis. And a lot of times when people hear sickle cell, they think of sickle cell anemia, which is like just one form of sickle cell, which is the most common one. And then the one that I have is called sickle beta thalassemia. Depending on the sickle cell you have, it's supposed to determine how severe your pain is. So most people with sickle cell anemia are supposed to have like the worst sickle cell essentially. However, everybody is different. That's the unique thing about sickle cell. You can be somebody who has sickle cell, like my brother, and he didn't get sick for the first time until he was in college. Or you can have somebody like me, who has been sick my entire life, but it wasn't to the point where I wasn't able to live like a normal life. And you can have some people with sickle cell who unfortunately aren't able to live a normal life and they're in the hospital all the time, going through numerous surgeries. So it's very complex. But the worst part of sickle cell is the pain that the sickling causes because you're not getting enough oxygen.
And how do you manage that pain?
I used to manage it with a lot of medication, but I knew for me, that wasn't the direction I wanted to go on in like forever. I always say that, yes, I have sickle cell, but sickle cell doesn't define me. Like, I know for me, I was like, I refuse to be that person who's just like on medication all the time, not able to live some sort of a normal life. And it's very hard to not be on the medication because you need it. You're in consistent pain. But I know the life that I was living, it wasn't beneficial to me. We could take it back to college. That's when my pain really started to exacerbate. I was taking a lot of medication every single day. So any narcotic you could think of, that's what I was on to really address the pain. I was doing oxycodone. I had to be on fentanyl. At one point, I had to be on morphine or methadone. And so you're taking, yeah, the narcotics every single day whenever you're in pain as needed. And then you're supposed to just, drink water and try to stay hydrated and really like do your heating pads and minimize your activities. But for me, I felt like it wasn't conducive to the life I wanted to live. So I tried to make a change. And so now it's been amazing because it's been about 4 years that I haven't been on any severe narcotics at all.
That's great.
So I got off of that in 2020. And so I'm on this medication. It's kind of similar to ibuprofen, but you just take it every day as needed. So it's not really as strong. Some days, I don't have to take it at all. And then some days I may have to take, more. But I went from having to do like 6 pills a day to only having to do, 1 pill a day. Like I increased my vitamins dramatically to help with my energy and to really allow me to try to live a normal lifestyle. And then I started working out a lot. And it is so hard when you're in a lot of pain to push your body. But I found that working out helps me out dramatically because when you sit for a while and your body's aching and it tightens, like a lot of times you have to get up and you have to get moving. So I started incorporating doing yoga weekly, which helps to release my body when I'm super tight, and just doing working out like fitness training and weightlifting and kickboxing. I drink water around the clock. I just think all those things incorporated just allow me to start living a healthier lifestyle. I also became pescatarian 4 years ago to try to eliminate certain foods that I also feel like contributed to me just not feeling like my best self. And I feel like this regimen has worked for me a lot.
Wow, I'm so glad you found that. It feels like
Yeah,
keeping
thank
your blood
you.
moving is important. And I think it's important for all of us, but
Yes.
especially I would
Mhm.
imagine for those who have the sickle cell disease. So
Absolutely.
it sounds like pain management is all that the medical profession really offers to help those who suffer with sickle cell. Is that true? Or is there some other way to
Uh,
help?
Yeah, that's a great question. I think now it's not true because they made a lot of advancements. I think back then it wasn't a priority unless it was a doctor that really cared about sickle cell. Like there are a lot of amazing doctors who care about sickle cell, like especially North Carolina. But I think, in the 90s and the early 2000s, it wasn't a priority because it primarily affects minorities, right? And so because of that, it was one of those situations where we're going to try to put a band-aid on the situation and manage it, but I didn't feel like it was like we're really trying to find a cure to it and seek treatment. And so it wasn't until I think like 2005 that they implemented hydroxyurea, which is a medication that you can take to regulate your blood flow. So a lot of young children who have sickle cell, you'll see they start to take that medication as well too. And I think that's when you started to see changes where it was like, okay, we're not going to just continue to focus on the narcotics aspect of it because that can do a lot of harm to people if you're taking narcotics from such a young age and then
Right.
all the way up until you're in college and until you're an adult. We're going to try to figure out other ways. And so then that's when they started really doing research on other medications, folic acid, doing gene therapy. So gene therapy has become extremely popular in the sickle cell community. There is technically a cure where you can do a bone marrow transplant. I know that it requires you to have somebody who has the same bone marrow as you that doesn't have sickle cell. And so that can become a struggle because typically that's a sibling. They were also trying to figure out a way for you to be able to incorporate your parents in the gene therapy and pull bone marrow from each person. So I know a lot of people have done the bone marrow transplant and that has been their cure for sickle cell. I actually looked into that before I changed my lifestyle around because that's a whole process in itself. You have to go through chemotherapy and like it's a major
Yes.
thing. But I feel like over the past couple years, you've seen sickle cell become so popular, which is amazing, and it's forced people to really like take a look into ways to advance the medication and the treatments and surgeries and different things like that. And then the other thing is that a lot of people have been doing blood transfusions. So before I switched to my new medication, that's one regimen that they would do it too, where they would take your blood out, like the sickle cell blood, and then they would take the blood that you would get from like the Red Cross and everything, and you would do a transfusion and get new healthy blood cells. And so that's something that they started implementing, I would say, over the past maybe like 7 to 10 years. And that's been helpful for a lot of people with sickle cell. So it's moving in the right direction. Being able to do the advancements comes with the resources. And I think at the time, the doctors were like doing the best that they could. And it's like the more you talk about a disease, the more you try to implement change, the more people get the resources that they need, because people are finally starting to realize like this is a very like important disease that we need to treat, because it really is very harmful to people who have it.
How do you think that transition happened? What happened in the world?
Yeah, well, one, I think you're starting to see a lot more shows about it, which I think is amazing. So I feel like that's been one of the changes. Like you would see Grey's Anatomy talk about it and Chicago Med talk about it. And then I don't know if y'all saw the show last year, Super Cell, that came out, the heroes of the show. They have a super cell, and their cell is that they were born by somebody who has sickle cell, basically. And so the whole premise is around that. And the guy said that he decided to write about sickle cell and make sickle cell the disease because he knew somebody who had it, and he felt like people weren't talking about it. And so I feel like you're seeing a lot more shows about it. The Shy talked about it. Power even had an episode about it. So I think, yeah, the more you're seeing people discuss it, it's becoming more popular. I also think that they're just naturally getting more resources because it is something that people are finally deeming to be important. Like I know our whole objective on the Sickle Cell Board is to really spread awareness about it.
Well, Black people have had a moment for the last few years. I don't know how long it's going to last, but I think that because it was a disease that mainly affected us, initially there was not a lot of attention or desire
At all.
Or research, right? So,
We're in that movement where Black people are really like, we need to advocate for us. I think every disease is important, but something that I've always said is like, it's a problem if everybody knows, okay, October is breast cancer awareness month, but we don't know September is sickle cell awareness month, right? Like in October, we go into stores like Ulta, and it's beautiful because you see breast cancer survivors all throughout the store in pictures where they've honored them for the month, right? But it's like sickle cell warriors deserve just as much appreciation as well, too, right? Because this is a disease that they're dealing with their entire lives. And so I think, like you said, people are now saying in the Black community, we need to focus on these diseases that's affecting us, because so many people in the Black community at a time didn't even know how you could get sickle cell, like what to look out for, that you should be getting tested. And so I think we're just in that movement right now where it's finally become a priority.
what kind of doctor do you see to take care of your sickle cell?
So it's a hematologist. That's who you would typically see.
And it sounds like you feel that you figured out a way to have your condition so well managed that you're not going to consider the bone marrow transplant. Is that my understanding?
Yeah, my doctors have been amazing. Shout out to them all, but I really owe my life to my doctors that I have now. That's the reason why I'm technically living in Atlanta, but I still go back to Charlotte every 3 months for my doctors. They're the ones who really found like a regimen that worked for me and changed my life. And so for me, I don't see myself doing the bone marrow transplant, because the whole purpose of me doing the bone marrow transplant was for me to be able to live like a healthy life and not really be in pain. And even though I'm in pain still now, it's so minimal compared to where I used to be. Like before I switched to them, I was in pain every single day for 6 years, like when I was in college. So growing up, I was at a place where I was in pain on occasions, right? And so for me, I thought that's how my disease was always going to be. And it didn't really affect me dramatically. Like I was still a dancer, cheerleader, student body president. Like I still lived a great life. It's just sometimes I would do a little too much and then I would end up sick. Or like think I was like everybody else and not listen to my mom when she would be like, wear a coat or do this. And then I end up with crisis. And then I would bounce back. But then one day I woke up. I would like never forget. I was at my godmother's house, and I woke up one day and I was in so much pain. And from that day forward, I was in pain every day for 6 years. And so for me, I like needed a way out of that situation because it was so debilitating, like trying to make it through that and make it through college and all this stuff. And so I really just wanted the cure for that reason. And so getting the opportunity to really change my lifestyle and not have to go through the bone marrow transplant was like a true blessing. Even though I'm in pain from time to time, it's nowhere near how it used to be. And I could easily live the rest of my life like this,
Mm-hmm.
um, and be completely fine because I've been in the hospital one time in the past 4 years for a crisis. Like for me, I hope to not be in the hospital at all, but that's a blessing compared to where I used to be, right?
Great. That's great. If you should choose to have children, would you have sickle cell trait testing, or have you thought about
Yeah.
that?
Oh, absolutely. Now that I'm an adult. When I was younger, it's like, oh, I'm not really thinking about that. It's not really like a priority. But over the past, I would say 5 years, that's been something that's been very like I'm a serious dater, and I know a big reason is because of my sickle cell. I don't have the ability to have like a oops situation because in the event that person does have a sickle cell trait, like that is a major like lifestyle decision, right? And so it's very important for me not to bring a child into this world who has sickle cell. Like that's a non-negotiable. If I found my person and they had the trait, I would not be with them because I know I want to have children because I would never want my child to experience what I've had to experience because it is a very like rough process. I have amazing parents, but it's been a weight on them and I wouldn't want to be like going through my own process of having sickle cell and then also have my child or children endure that as well too.
I mean, that says a lot right there that you would make that decision.
Yes, hopefully I don't have to, but yes.
Yeah.
Yeah, fingers crossed.
It's better to think about it before you're in it than to have to decide
Right,
once you're there. So.
exactly.
But on that point, do you know the sort of rate of sickle cell in the African American community?
That's a good question. I don't know the percentages of people that have it. But doesn't just affect us. That's a common misconception too, because there are people like white people, Indian people who have sickle cell as well too.
We don't generally know whether we have the trait or not unless we've actually been tested and asked to find that out, right?
Right, right. Because what would make you think to get that testing
Right.
done? Like, same with my dad. You know, my parents found out that my dad had the trait after they had me because then they found out I had sickle cell. Like, my mom knew she had the trait. I don't know if she just knew because she was tested, but they didn't test my dad. So he got tested in the 90s for the sickle cell anemia trait, but at the time they weren't testing for all the traits. So he didn't get tested for the
Oh.
anemia and all that stuff. And naturally, he didn't know that he had the beta thalassemia trait. So then they had me, and then that's when they realized, like, oh, he has this, and there are multiple types of sickle cell as well.
It's very complicated.
Very complicated.
So I can imagine, just the thought that you have to think about that in your dating and your future children. There's a lot of things that you've had to think about in your life. So would you say that obviously this has affected you physically, but how's your mental health been affected by just having to live with this?
It's definitely a lot. Like, it is a whole lot because I think that there's so many nuances that you go through mentally, like living with a disease, especially a disease you're born with, because you really like didn't even get a chance to have any sense of like normalcy without being sick. It affected me, but it really wasn't as bad until I got to college and I started getting in pain. And it was really like bad because for me, I was like, it's not going to define me. I'm still going to do whatever I want to do and push myself, which is good to push yourself. In hindsight, I probably pushed myself a little too much because I wanted to prove like I'm not going to let it have this hold over me and I'm just going to be like this strong person. But it definitely weighs on you. I think the first thing I went through mentally was like being very angry. Like I went through that stage. I was in college of like, why me? Like, why God? Like I was just very angry and feeling like I had no one to blame. It's like, I can't blame my parents because they fell in love and they had me, right? That's not fair for me to blame them for that situation, right? I can't blame myself because I didn't do anything to cause me to have sickle cell. So it's like, who can I blame for giving me something that's so traumatic that it just literally alters your entire life? So I went through a period of being just so angry about it, especially when I was like in so much pain because it's like I'm trying to do everything in my power, and it feels like it's not enough, right? Like imagine, you wake up and you're in your 20s, but you really feel like you're old because when you get up, it's so much pain rushing through your body, and you're trying to like just get up the strength to get out of bed to then start the morning of like, getting in the shower and getting ready and all this stuff. And so for me, I've always been like a hustler. Like I have really big dreams, and I felt so defeated because it's like I want to accomplish all these things and I can't because something is holding me back. So I think when I was younger, I went through so much anger, so much sadness. I definitely went through a depressive period. Like I remember hitting like my lowest point when I was in college because I had just crossed when I was out as a Delta, and because I had crossed, like I ended up with like a really weak immune system, so I ended up with a really bad stomach virus. And when you have sickle cell, you're susceptible to a lot of illnesses as well too. And so I ended up with the stomach virus. It caused me to like lose 14 pounds in like 3 days because I couldn't eat. And I lost the ability to know how to eat. So my mom had to teach me how to eat all over again for like a
Wow.
month. And so in the process of going through that, I had to get like incompletes in all my classes and push me so behind. And I just felt like another thing I'm going through on top of everything else. And so I was just at my lowest point, and I remember like one night I just was literally like crying out to God because I was so sad. Like I was like, I can't go through this anymore. Like I just feel like I don't have the strength, and everybody is always telling you how strong you are, how strong you are, how strong you are. And I get when people say that, they feel like it's empowering. But sometimes it's like, I don't want to be the strong person. I want to be weak. And I went through a process of wanting to like end my life, and I took a whole bunch of medication. I don't even think I wanted to like not live anymore. I just think I didn't want to be in that state anymore. And I remember when that situation happened, like I was at my parents' house, and my line sister at the time, I must have said something to her that made her know like something was wrong. So she found my mom's number. She called my mom, and my mom rushed upstairs, and I had taken a bunch of medication, and they rushed me to the hospital. And I feel like in that moment, I was like just telling God, because I had really like lost my faith. Like I didn't
Mm.
believe in him. Felt like he had like left me to figure everything out on my own. And I really was just like, if you could see me through this situation, like I promise I will trust in you again. Like I just need, like when they tell you to have like the faith of a mustard seed, like I was like, I just need a sign. Like I just need something, like something. And so I went to like the mental health clinic for a couple of days, and they end up like discharging me. And I started talking to a therapist, and that became so like beneficial because it allowed me to talk to a random person and just like share all my feelings and just get it all out on the table and just be like very transparent. And I just saw God start to move in my life. Like I didn't think I was going to graduate because I had fallen so behind in my classes. And like the professor started like giving me a lot of grace and like, really helping me get the grades. And like I started feeling better, and I just like slowly started to feel like myself. And I just one day I was really just talking to him, and he said to me, like, I really heard God say, I put you here on earth to really make a change with your disease. Like, I know you're looking at it like it's like a punishment, but I promise you, you have the strength to make it through. Like, this is
Mhm.
really like a blessing. Take your life and make it something beautiful so that other people coming behind you can see, like, this does not have to define you at all. And so there's like so many things that I wanted to accomplish in that space that I was in, that I'm like now in that season. Like, I didn't know when I was in that space, like, would I become self-sufficient? Like at the time, I didn't have a steady idea of like what my career was going to be. Like, would I be able to travel the world? I've had my passport now for 3 years, and I've gone out the country every year. Like so many things I didn't think I was going to be able to do. Like God really has shown up.
Oh,
Yeah. I
fantastic.
mean, what a story. So many blessings to have
Yeah.
that friend
Yeah.
who was there, and to have your
Mm-hmm.
parents who have always been there to support you, and
Always
to,
been there.
and your
Amazing.
faith. All of those things. I mean, it's so wonderful to see you at the place where you are
Yes,
now.
I know. And it's been so beautiful. That's why I really try to give back from my disease. I really try to encourage people now to that it's going to be okay. And I think it's important to go through your emotions. Like you have to go through those stages, in my opinion, to get it out of your system. Like I needed to go through stages of my life of that anger and that sadness to get to the place that I'm at now. Where for me now, it's like, yes, I have this, but I understand like everybody was dealt cards, right? This just so happened to be the cards that I was dealt. And although it's rough, it could be worse, and I'm fine.
One thing that we hear a lot is that as Black women, our pain is not always taken seriously by the medical profession. So I wonder, you've had great doctors and I'm happy. Has it always been
Hmm.
great doctors? And whenever you've had a crisis or an experience when you've sought help, has your pain always been taken seriously?
Right. No, it hasn't always been, I would say, great doctors, because I think that a lot of times doctors, they focus on you heavily when you're a kid, right? Because it's like that sympathetic, oh my gosh, I can't believe a child is going through this. Like, I'm just going to be there, be there, be there. But as you become an adult, that really starts to taper off. You don't get that compassion that you needed. And like, I'll never forget when I first started getting in pain when I was in college. I had a doctor at the time when I was transitioning, and I'm very knowledgeable about my disease and I am a big advocate on it. But I was telling him, I'm like, something's not right. Like, I'm in a lot of pain. Like, I'm in pain every single day. Like, something is going on. He was like, that's impossible. Basically, you have sickle beta thalassemia. It's no way that you would be in pain like every single day. Right. And he's going based off of what he feels like he was always taught,
What he's
which is that, like,
reading.
if you have sickle beta, it's rare, it's not that bad. And I'm like, no, I wouldn't make this up. Like, I promise you, I'm going through like really bad pain. And so I ended up switching doctors, because that's one thing I don't play about. I don't have time. Like, I'm going to tell you one time, and if you don't want to listen to me, then I'm going to find somebody else.
Yeah.
And so for me, like, I learned how to advocate for myself. Like, I love my mother to death because she will go to bat for me. But I realized early on, like, my mom's not always going to be there. And so I have to figure out how to advocate for myself, even when I'm in my worst state. I was in college one time, I was having a crisis, and I drove myself to the emergency room. And when you're in pain, I know it sounds like, oh my gosh, you may not be in that much pain because you're able to drive yourself. But when you've been in pain your entire life, it's like a mental thing. It's so many days I'm in pain where I push through, because it's like, if I don't push through, I would never accomplish anything. But you mentally tell yourself that you can just power through it no matter how you feel. So I got to the emergency room, and they thought that I was drug seeking, because they said I didn't look like
Mm.
right. I was in pain because I had come from my class. Like, I was having a bad crisis. I literally probably looked similar to this. And then it was like impossible. So my mom said, right, in the future, that you need to start, like, unfortunately, looking sick. Like, that's a decision we made.
Like, take all your makeup off or something? Like, what?
Yeah.
Oh my
That's what
gosh.
she said to me. And I know she was coming from a good place, because she wanted me to make sure I got the medication.
Right.
It should not be like that, but that is how it is. Like, I went back there and I really went off on them, because sick or not, you're not going to refuse medication from me, especially when in my chart, nothing speaks to me drug seeking at all. Like,
And I have
they
sickle cell.
and sickle cell. So it's like, this is a priority. And so knowing your health, you have to know, like, this is not okay, and you're not going to do this to me. And I will stay here as long as I need to stay here, because the emergency room is one of the worst experiences I feel like you have as a sickle cell patient, as a patient, period, but definitely as a sickle cell patient. Those doctors, unfortunately, are on go all the time. They have so much going on. They don't have that empathy that you need, because they're trying to get you in and out. They just want to make sure you're okay. And because of that, they kind of treat you just like whatever. And so for me, there's been so many times where I've had to tell a doctor, are you okay? Because I don't personally want you treating me if you have bad energy, because I know I didn't do anything to you. And this is in the worst place that I'm in my life right now in terms of this pain. And I need somebody around me that's going to act like they understand the severity of what I'm going through. And if you can't do that, then I don't mind requesting another doctor.
Wow, that's good to be able to just say that
Mhm.
and say, hey, you
Mhm.
can't help me right now, so give me someone who can.
Give me
Yeah.
somebody else. Right. And that's why I tell patients all the time. And unfortunately, I feel like I just have that personality anyway. So it's easy for me to be able to do that. But everybody doesn't have that personality. And I share that with people. Like, it can be a life or death situation. Unfortunately, it's been so many sickle cell patients who have passed away because they were treated like their pain was irrelevant and was not taken serious or disregarded. And so in those situations, you have to advocate for yourself and take it there without even being disrespectful, because if you're not advocating for yourself, who else will, right?
Giving them some of this language that you've been using will be quite helpful to say, let me help you understand what I need. So that's great. That's great. But I want to go back to the mental health part, because being in daily pain
Mm-hmm.
is a level of stress that seems that could be mentally crippling.
Mm-hmm.
And I know you went through that very scary period and you were able to come out of it. What do you do now to keep yourself
Yeah.
strong?
Yeah. So no, it's definitely a lot, especially trying to balance like having a career and everything. It's a lot of stresses that comes with still trying to survive like in this economy. So for me, stress will make your pain worse. That's always been my experience. So I have to always figure out a way not to work myself up a lot. And so, like I was saying, yoga is something that I incorporated last year that I decided I was going back to. Doing that once a week is so helpful because it just allows me like an hour where I'm just relaxing, really like getting my mind right. I love to get massages done. Like that's something I'm gonna do this year is to get a massage once a month because that really helps me with like my body and then also just alleviating the stress where I can just relax for a little bit. I got a therapist, so that's been something that's been important to me is like really having a therapist and talking to somebody. With my church I joined in Atlanta 2 years ago, and it's been amazing. And then you join a small group called a squad, and those girls have been like a lifesaver. So we meet once a week. Yeah, it's
Nice.
amazing. We become like sisters. We talk about any and everything. So when I am overwhelmed, that gives me like a very safe space to talk. And then I think for me, I find ways to have fun, like understanding that I'm gonna have this disease, I'm gonna go through things, but I don't want it to eliminate my ability to really like live life. So I try to have a balance between the two. Because if I don't, it can really cause me to be stressed trying to like balance having my health, working, doing all these things. So I incorporate fun. I like to live life to the fullest. So I'm gonna figure out to have a great time. And I think all those things have helped. Journaling is something that I do as well too. And really just talking about it. Like I think talking about my health helps me as well. So all those things have really helped with my stress and minimize it. And I think because at this point now I've been dealing with it for such a long time, I just figured out a way to not let it get me to a place. Now sometimes I still have my moments.
Mhm.
Sometimes you gotta have a good little cry session. I gotta call my mama. That's my certified therapist. Like, girl, I'm going through it right now. This is a lot. And so she just gets me without me even having to say it. So that helps me. And I think sometimes, you do have those moments. I still have them to this day, but I think I figured out a way to really alleviate it as much as possible.
How do you think being a Black woman has affected your experience?
Hmm. I feel like being a black woman has affected my experience because it's required me to like really learn to advocate for myself. And I learned because of my disability to really understand like the gravity of being able to speak up for myself because if nobody will speak up for me, I have to understand and speak up for me. That's the worst thing about living with a disease that's really like a hidden disease.
Mhm.
Like if you were to take me and put me beside somebody who broke their leg, they would assume the person who broke their leg, if they're in a wheelchair, they're going through more than me when I could be literally having a crisis where I'm at an 8 out of 10. And so I think as a black woman, they a lot of times will put me in a box and they think because I'm Paige and I'm this realtor when I have X, Y, Z going on that I can't also be Paige who has this disease that is in pain and has to take this medicine that sometimes may have to go to the hospital and really is in need. And so for me, I've had to learn to be as transparent as possible. Like that's why I have become very transparent about posting about my experiences and showing when I'm in the hospital and in pain to show the gravity and to show that we are complex and I can be both things, right? Like I have layers to me. Like I can be in the ER one day and then 2 days later I'm out, and I'm selling a house, right?
Mhm.
That's a black woman encompassed in one. I am layered and I am a multitude of things.
Excellent.
And what would you need from your medical provider to feel well cared for?
Like mine in particular, I would say nothing because as of now, I got blessed where they have literally given me everything I could have wanted and more. Like they really like love on me a lot. However, I think as it relates to a disease as a whole, I think we need more medical providers. Like, I think sickle cell is one of those diseases that you really have to understand the complexity and really want to change to be involved with it because it requires a lot.
Thank you. I just want to follow up on one piece. You said that your current
Yeah.
medical provider
Mm-hmm.
gives you everything you need, loves on
Mm-hmm.
you.
Mm-hmm.
Can you tell us 3 things that that person does that are particularly valuable to you?
Okay, yeah. So the first thing I would say is always being available. So last year I had my first crisis in 3 years, unfortunately, and it was probably honestly like one of my worst crises. And I was here in Atlanta, and so for me, it was like, oh Lord, because I didn't switch my insurance over here in Atlanta. I hadn't even taken the time to get to know the doctors here because I had been doing so well, and I was just going to North Carolina. And so when I was in the crisis, I was like screaming so loud that it caused my mouth to swell up. So I couldn't talk at the time. So I was literally like talking to my mom and saying what I could say. And somehow I gave her like my login information to my chart, and she located my doctor. They had never spoken, but he immediately like contacted her. He called the doctors at the hospital immediately because they were not giving me my sickle cell regimen like they were supposed to. And like I said, typically I can advocate for myself, but I was in so much pain this time. I didn't even have the ability. Like I was in and out of sleep, so like out of it. And he literally like changed the course and trajectory. He was like, no, like this is what y'all need to do. This is unacceptable. I literally saw him a couple weeks ago when I had my appointment, and he was like, yeah, that crisis was crazy. And I was like, absolutely not to those doctors. So I think that was like the first thing. The second thing is his and the nurse practitioner's ability to like really listen to me. I don't feel like I'm like a patient to them. I kind of consider them like friends because for me, when I first came in, I was like going through withdrawals off of my narcotic medicine, and they really took heed to that and was like, let's switch and try a different regimen, which is how I ended up on the regimen that I'm on. And so when I come to them, they really listen to me. And if I'm telling them something is a concern of mine, or I feel this or I feel that, they don't disregard it. Like they really take the time to understand and be there for me. So I really appreciate that a lot. And the flexibility, I would say, because I'm here in Atlanta, they work with me. Like they allow me to come every 3 months and do my appointment. If I'm doing well, they'll allow me to do a video visit. They could have decided a long time ago, you're in Atlanta, we're not going to be your doctors anymore, but they understand that I really, like them. They like me. They've been really beneficial in my life. And so for me, I can tell they genuinely care. And so because of, yeah, it's been a great experience. Of
Oh, I'm so glad you have them. That is great.
Thank you so much, Paige.
course. Thank you.
Thanks for listening. Want to hear our take on this conversation? Check out our After the Show episode right here. For resources related to today's topic, see the show notes.
If you want to support Body Wealth, please subscribe on Spotify, Apple Podcasts, or YouTube. We'd also love it if you give us a 5-star rating and write a review letting us know what you love about the show.
The Body Wealth podcast shares personal stories to inspire you. It does not constitute medical advice. For that, we encourage you to work with a trusted healthcare provider. We also want to remind you that the views expressed by our guests are their own.
This podcast is dedicated to our mother, Jean Fernandez Barbour, who showed us what advocating for yourself really looks like.